Hi, my name's Tina. I'm from the Tranquil Tummy. I'm here today to have a little chat about IBS. Maybe you've just been newly diagnosed, or maybe you're still getting to grips with the condition. There's just a few things I was going to run through that might be useful to you today. So living with IBS can be challenging sometimes, especially if you're getting quite a lot of symptoms at the moment. Perhaps some stomach pain or bloating, diarrhea or constipation. It's really important to understand the symptoms and how you might be able to manage them. Also, understanding the link that stress and anxiety have to IBS is important. Learning about IBS through different websites and perhaps support groups can really help you to feel like you're getting to grips with it and not letting it control your life. Diet is really important with IBS. So it's about getting to understand what are your trigger foods. So sometimes keeping a food diary can be really helpful. You can get to know what foods you need to avoid and what foods are well tolerated. Common things in the diet that can be trigger foods are high-fat foods, spicy foods, and sometimes caffeine. It's really important to get to know what your trigger foods are so that you can eliminate them or reduce them right down to stop flare-ups happening. So eating slower with IBS can be really helpful. It can allow your body to gently digest the food that you've eaten and stops flare-up of symptoms. So drinking plenty is really important with IBS. So drinking lots of water, keeping well hydrated. It's important to keep your poo soft so that you don't get constipated and make things easier within your digestive system. Things like herbal teas, peppermint and ginger are really good for IBS symptoms. So teas with those components can be helpful to soothe IBS symptoms as well. So managing stress and anxiety with IBS is also a really important factor. So stress and anxiety can really cause flare-ups of IBS. So if you're able to do things that help you to reduce your stress levels, manage your anxiety, then that can really help with reducing the amount of symptoms that you get. Sometimes this may be just doing mindfulness or yoga, some deep breathing exercises. For some people, this may mean getting counselling or seeing a therapist to deal with any background issues that are affecting their emotional well-being, or finding techniques for yourself that are helpful with managing stress, such as emotional freedom technique. All of these things will calm your nervous system and allow your digestive system to be more relaxed and able to do its job. Some people with IBS do need medications. So this is about speaking to your doctor or your pharmacist to get advice around this. Supplementation can also be helpful. So seeing a nutritionist or gaining advice and guidance around what supplements might be suitable for you can also be helpful. Another thing that can really help with your gut microbiome can promote a healthy gut, which can work effectively. There are lots of different sorts of probiotics though, so it's good to get some guidance on what might work well for you. So adapting your lifestyle a little to help with your symptoms can be useful. So planning around how you're feeling is really important on a day-to-day basis, and making sure that you get enough rest and enough sleep and enough time to relax. It's important to share how you're feeling with the people around you who care about you so they can give you support. And so you don't feel on your own with all of this. So make sure that your IBS doesn't isolate you. Still connect with your friends. Get out when you can. Explain to them what's going on for you. They'll understand and support you. But it's important to be able to get on with your life as much as you're able so it doesn't start to detrimentally affect your mental health. It's a really good idea to keep a diary so that you can sort of track your progress, seeing what symptoms you're having, what food you're eating, whether there's any triggers in there, how you're feeling emotionally, what was going on in your life. You can start to see patterns so that you can manage things in the future. IBS can be a challenging disorder to live with, but learning to understand it and doing all the things that we've mentioned here, so a gut-friendly diet, staying well hydrated, getting the social support from family and friends, getting medical advice when you need it and dietitian advice around your diet, perhaps using probiotics or supplements and medications from your doctor, you can regain control of your life. So it's really all about exploring and experimenting with how things work for you, finding the best mix of things that work well for you so that your symptoms are reduced, your stress is managed, seeking guidance from professionals, from your GP, from dietitian as needed. You'll feel much more in control, like you have some power over what's going on in your life without IBS dictating to you. I hope this information has been useful to you. This is Tina from the Tranquil Tummy, and I'll see you again soon.